This week on the BackTable Podcast.
Suicidality is it's interesting. It doesn't just come out of the blue, or at least for me. I'm just, everything I speak is from my own experience. It starts kind of like a whisper, and then it gets louder and louder, and then it becomes more like a scream, and then it consumes everything. And that was quite alarming to me. That's when I reached a breaking point, basically. I try to think, like, now that I've kind of recovered from that part of my life, I'm thinking, what did I need back then? What could I have benefited from?
Hello, everyone, and welcome back to the BackTable Podcast, your source for all things urology. This is Aditya Bagrodia as your host this week, and I'm excited to introduce our guest today, Nishant Patel, who I've gotten to know as a friend and a colleague here. He's a practicing urologist in San Diego. Nishant, how's it going today?
It's going very well. There's a lot of commotion around Southern California today with the fires and all that, but I'm glad I was able to make it down and speak with you today. Thanks for inviting me down.
Yeah, it's a pleasure. It's a pleasure. And, Nishant, I've had the good fortune of kind of following your career highs and lows, if you will, and personally found it to be a real source of inspiration and strength. Certainly some parts of your story are going to resonate with everybody. But I thought maybe we could just start out with some of the basics, a little bit about your background, how you got into urology, and
sure.
What were some of the kind of early experiences that have shaped you?
So I think before I do all that, I do want to just put out a kind of trigger warning. We may talk about depression, substance abuse issues, suicidality, life, basically. And I do want to just kind of take a moment of silence, if that's all right, to kind of, for those that are still suffering out there, those that we have lost to mental health issues, substance use disorders, physicians that I've known, friends, colleagues. So I'll take a moment. And then maybe a continuation of that moment, we can all just kind of reflect on when we, we're at our lowest point, whatever that may be, physical or mentally, and then who is there to help you through it, and then like a moment of gratitude. So that's something I try to do at the beginning or the end of every day. All right, let's get into it.
Yeah, thanks for that. It's a nice way to kind of level set. And, this conversation, I suspect, is not going to be necessarily typical. But yeah, tell me a little bit about, the early days and intro into urology and, some of the things that happened early on that shook you or shaped you or both.
So, I grew up in a small town in northern Arizona in a town called Prescott. It's a small town and there wasn't a lot to do. And I had a pretty good childhood. There wasn't a lot of, trauma or drinking or anything like that. But, I do recall my very first drink and, the effect that it had on me. It was not typical, I think, of like most people that have a drink. Like, oh yeah, it was fun. We had a good time. I go, oh, this is the answer to all my problems. Like, I've always felt like I didn't belong or other. And I go, this is it. This is the thing. That's kind of more common for people with, alcohol use disorder, alcoholism. They remember very vividly the first time they took it. And, it was a problem right off the bat. But I was very studious at the same time and, excelled in high school, in college, but also drinking. And I used one to justify the other, kind of saying, work hard, play hard. And, I had stumbled into urology during a rotation and, I'm kind of a all-in type guy. And so when I found urology, I said, this is what I want to be. Also very committed to drinking at the same time. And, I justified a lot during medical school. I mean, the problem became very severe in my third year. It was daily drinking. I remember pouring, water bottles out and filling it with vodka, thinking, this is fine. Everything's fine. I'm going to be all right. And there are warning signs and all that sort of stuff. But it became very problematic, And what I wish would have happened earlier on is, if someone took me aside and just asked like how I was doing, or, what is all this about, right? And, either it was ignored or it was almost punished, like with threats, like, you're not going to finish medical school. There was no addressing the real problem. And, I tried to match into urology, was drunk during interviews. I wouldn't have hired me. And, I still wanted to do it. So I bounced around different research positions and went to Cornell for a bit, Detroit, Henry Ford. That's where I initially got sober, was at Henry Ford, was in Detroit. Found my way through a 12-step program, AA. It really worked for me. Matched here in San Diego, and was monitored for a long time, for 5 years, and successfully completed that. And, I thought things were pretty good. Went to fellowship at Cleveland Clinic, really turned things around. I got a job at UCLA and then University of Virginia, but then life hit me. And, both my kids had significant health issues, and I was working full speed. And, I've had a history of depression, and the depression hit very hard. When I was here a resident in San Diego, there was a lot of compassion shown and understanding. And I feel the way we treat these issues, really affects the outcome of individuals. And I was not shown that in Virginia, basically, at my previous institution. And there are a lot of factors, but eventually I was let go from that job. And the depression spiraled in a way that I never imagined. I was confined to the guest room, to my bed. Some days I couldn't get up to brush my teeth, And then the suicidality is it's interesting. It doesn't just come out of the blue, or at least for me. I'm just, everything I speak is from my own experience. It starts kind of like a whisper, and then it gets louder and louder, and then it becomes more like a scream, and then it consumes everything, it consumes everything. And that was quite alarming to me. That's when, I really, I reached a breaking point, basically. I try to think, like, now that I've kind of recovered from that part of my life, I'm thinking, what did I need back then? Right? Like, what could I have benefited from? And one of the things that really helped me was I was put in touch with another surgeon who'd been through something very similar, and we talked, and just seeing him get through what he went through, right? That's what it took for me. And so, I recovered from my depression, and my kids' health improved, and we came out here to San Diego, and now I work private practice. I'm about to finish my MBA down at Rady over here. And I launched a platform because, out of all my experiences, there's a lot of just harrowing, dark times, and I had to turn it into something that could potentially be positive for other folks. So the platform I created is called SafeHavenMD, and it's fluid, it's in the works, it's live, but a lot of folks from business school are helping me kind of figure out the next steps, and your podcast started out early and small, right? And you were able to scale it. So we're talking to a lot of people, because there's peer support networks that have been shown to work for the general public, like Talkspace, this thing called 7 Cups Together All, and we're talking to them as well to see how to do this thing. And it's very exciting. It's deeply personal. We've had a few clients already. And, one of the most common things I've heard from the clients is like, whoa, like, so you were there, still drinking despite all the consequences, and you continued, but you made it. Oh, you were there, ready to end your life, but you made it through. So it's been very touching to hear these stories, because they're out there, right? And so opening up the dialogue is, I think, the hardest step, but it's a very humbling thing to do as well. for people to completely open up and to see how, maybe how my experience can help others. And so that's what I'm doing.
Yeah. I mean, thanks for sharing, Nishant. And I can't imagine what it's like actually to kind of talk about these publicly. I imagine that's been a kind of dynamic and evolving process.
Right.
Elizabeth Kubler-Ross-esque denial, anger, why me? And there's so many things that kind of blossom from this. I mean, the first question is, you seem to mention that that maybe this issue you were having with alcohol use, abuse during medical school, that people knew about it, and it was either we don't want to address it, or it's going to be like choose another path after you spend the last 20 years of life or so, working towards this one goal. And as a doctor, I'm not sure that I have tons of other skill sets that are easily transferable. Talk to me a little bit about that, friends, family, was there yourself, were there times where like, I'm getting close to reaching out and it just didn't seem right? Or were there times that you did engage in something kind of to try to change the direction?
I mean, a lot of it, I will say, was kind of forced upon me, but by family. It wasn't until everyone reaches their bottom with this disease, and I decided what that would be. I mean, it was bad, right? Like I was having, physical manifestations of withdrawal, like seizures, DTs, like the things we read about in the books. I was having those consequences, and it wasn't until I decided, right? There was a point that had to break, and I wish it didn't have to get that bad. I just wish there was some way to do it earlier. We know that early intervention works, but the, depression is very powerful. Substance abuse is very powerful, and people have to really see those consequences, feel them, and then that brings the internal change. But it wasn't until I wanted it for myself.
Do you think in medicine, and maybe particularly in surgery, that there's a bit of a vicious cycle, high pressure, high intensity? It's inherently competitive. It's, in medicine, you're dealing with heavy stuff, life, death. In surgery, there's bad outcomes. Was there some degree of the chosen profession affecting you maybe more so than a non-doctor?
Surgeons are very driven people, right? And we're often our own worst critics. I think you had Dr. Koshik talking about yoga. There was a previous podcast I remember, and he said, there's the people that drive us the hardest or, be most critical is ourselves. And so, yes, there's outside external pressures and demands, and, surgeons will find lots of outlets. You'll find, and there's healthy, positive outlets, I know a lot of surgeons doing kind of martial arts and things, to kind of release that. Other people, have different exercise habits, or there can be negative coping mechanisms too. And I think it's all in the hope to find some balance, right? We're doing it for a reason, to kind of counteract this drive we have. We have to, balance it out somehow. And for a lot of people, unfortunately, it's very detrimental.
I think absolutely elements kind of resonate, and you talked about some kind of low points where you kind of decided, and I mean, walk us through a little bit more granularly. It's like, okay, today I'm going to go check in to rehab. Am I going to go, am I going to wean off of drinks from whatever volume down to this so I don't have a major withdrawal episode? Did you reach out to some institutional resource?
Yeah. So I'll tell you exactly what happened. I was drinking a lot, and I missed a few days of work, called in sick, and, decided I need to stop. So I found a detox center with a physician, right? I was like, oh, I'll just drive there on like a Tuesday morning. Got pulled over for a DUI, was in a Detroit jail cell. And I remember that moment right there. I go, what is going on? You're here on a Tuesday morning in a Detroit jail cell. Is this how you want is this what you want in your life, And, and I knew there's always almost something outside of myself where I was given two choices. Like, you can continue this path and then you will surely die of your disease. And I didn't know what like life really looked like. It was just like, or another thing. And yeah, that's what I chose. And I was lucky that I chose that because some people continue, right? I've had to go to many funerals I started the process of recovery in 2008, and, people that I love, the disease took them. So I'm just fortunate to have that experience,
And I'm guessing that a lot of your social infrastructure, kind of people that you hung out with, were all more of I'm assuming, I don't know this, was it you were kind of like lonely by yourself drinking, or was that
That's how it ended up. Yeah. I mean, curtains drawn, by myself, just feeding the addiction. Just really dark and lonely, right? And I didn't know of solutions, right? I had looked into 12-step and recovery meetings, and I think you have to find the right group and the right people, and then once you surround yourself with those people, then you got a chance. It's all about turning the momentum, I think, even, with substance use and depression. My episode in 2021, it was like, all right, like today, I'm definitely going to brush my teeth. And that's what I had to start with. I'm definitely going to get out of this bed, and I'd start slow. Like, I'm going to eat breakfast. Then like one of the things I love doing is cooking, and I just stopped. And like, I had to gear up for weeks to even try to plan to make dinner for my family. But I remember I did that. It was a big deal. Sorry, getting emotional.
I, again, appreciate you sharing all these deeply personal experiences, Nishant. And I think a lot of this stuff that we take for granted, that when you're there and, things are looking so bleak, I think it's very introspective that you don't know what the other looked like. You've been on this path for 6, 8, 10 years, and it's like, what does not this look like is super foreign. You mentioned you got lucky, you found the right group and the right people. Maybe we could use that as a bit of a segue for SafeHavenMD.
Yeah, for sure.
Is that the goal? Is for people that are struggling to find something that have like a deep common experience?
The vision that I have is creating one of these, what we call peer-to-peer networks. Like I said, this exists for the general public, and there's, sections within these websites, like Talkspace specifically, for healthcare workers or something like that. But, just to go over kind of some statistics, I think, like 50% of physicians report being burned out, and 20% meet the criteria for depression. And then when this is all from Medscape surveys, and then when kind of probe deeper, they ask, like, what's your, reluctancy for getting help? And it's confidentiality, feeling like that their doctorhood, they shouldn't feel that way, basically. They shouldn't be able to think their way out of this, or it will go away if I ignore it. And there's the fear of repercussions if this gets out. And that's a real one, right? And then, on your licensing applications, you're asked, do you have a history of such and such, substance abuse, depression, whatever? And 50% of people just check no when they have it or are being treated for it. They just like, no way, I don't want them to know. And so we just have a culture of silence and suffering. And I think Brene Brown says, shame suffers in silence. It just gets worse. It gets worse and worse. And so, what we offer is confidential and anonymous as well, if you prefer. And we've had some folks do that. Just, I don't know who they are. I know nothing about their lives. I just know that they're struggling. And I'm not a substance abuse counselor. I'm not a psychiatrist. I'm not a therapist. I just have experience. I have my own. No one does my experience better than me. I'm an expert in my own experience. And it's tailored. Every person's story is different, local resources, online resources, and we're trying to build on the site itself, potential webinars and things like that. And we're in talks of having another physician come on board. But it's hard. It's hard to put myself out there. Like everything that I just told you, not easy, but it's important. I don't expect everyone to get out here and put it out there for the world, but at least open up to someone that they can trust, who's not going to judge them, who's not going to, punish them.
I think it's amazing. And, one of the areas of our field that I have some interest in is kind of how we handle complications and some of the impact of that. You and I have talked a little bit about it, and you have something go on and then you're in a lonely, deep, dark place. You don't want to talk about it. You're embarrassed. You're wondering what other people think. I mean, if it's a pattern, there are and should be repercussions. And
yes,
yeah, I mean, it can threaten your livelihood. It can threaten your identity, and it's a whole thing. And what I've found is there's the informal. You're just chatting with somebody, and it kind of comes up, and that could happen. That depends on their introvertedness or extrovertedness and comfort and trust and a lot of different things. I think to be proactive about it, how you kind of screen for these in like a real way leads to a lot of the confidentiality concerns, judgment issues that nearly certainly I think a lot of people have. Peer support. I mean, I think one end is, here's your employment assistance program 800 number, and I'm just going to take a venture guess that the utilization of that is generally quite low. But something that, is a little bit more for us, by us, I think could kind of resonate. Walk me through it. If I heard this episode and I'm like, what, I think I'd like to see what kind of resources these are. I go to a website, SafeHavenMD.
Right. SafeHavenMD. It's built to schedule a time. We can do things either, anonymously. Right now we're trying to build that out, but it's through, Signal right now. Or you can tell me who you are, which is totally fine, because we don't keep records. We don't really report to any agency, and we've consulted with a legal team and have a little portion of our website dedicated to that. And I've been told some things, right? Some very concerning things, right? But the whole idea is not punish somebody, because that's the main barrier a lot of the time. And I want to get back to a point you said. So if it's a pattern, like, yeah, I was not safe at a certain point, right? And I had to deal with the consequences. I'm not, I didn't ask to become someone, have a mental health issue or substance use disorder, but I am responsible for the consequences of that. It doesn't free me from that. I don't abdicate that responsibility. And it's a fine line between, understanding and realizing if you want to continue to be a physician, you're going to have to do some things. There's monitoring programs that have an insanely high success rate, like 80% out there. It's around, 30 to 40%, maybe if that. But setting the structure, I think, even though I did it begrudgingly for 5 straight years, incredibly helpful for me. And to get back to your point, we may not solve all your issues if you contact SafeHavenMD, right? But we can start something, figure out a plan for you that works. And the decision to kind of confide in your leadership, you kind of have to assess, are they a safe person to do that too? Because sometimes they're not, right? They're not on your side. And things can be done completely privately as well. When I was back at my old institution, I said, they said, this is your therapist, this is your psychiatrist. And they all worked for the hospital. And I was like, oh, I don't know if I want to tell them anything. This all feels, stacked up against me. And I think people just do well when they have options. When you can give them the freedom to choose how they're going to get better, rather than saying, this is how you're going to get better, giving them that choice back.
Yeah, I mean, it leads to a question that I have of, if one gets to the point, whether it's more substance related or anxiety, depression, burnout related. I mean, substance is a little bit easier to provide an example where either you're going to do this selectively or it's going to happen because something went down.
Right. Yeah. There's no, so this is an interesting topic. So there's a new kind of push for harm reduction, which is like a path to abstinence, or, not using or drinking. And 100% physicians cannot be under any substance at work, right? Like there's no middle ground for that one. And so that's tricky too. Does this model apply to physicians? The answer to that, I don't know. But it's something to think about, because these statistics, they're not getting better over time. Like there's programs out there that exist that help the physicians, but overall they're either steady or increasing. And there's a big push for like burnout prevention and all our modules and all this sort of stuff. But what if people are already there? They're beyond they're just suffering. Like, what can we do for them?
So maybe we take burnout or fairly debilitating depression or substance, where the individual feels like I am not able to personally and professionally perform at some reasonable level that's either not acceptable to me or it's not acceptable from a patient care perspective. So elective path, maybe if we're talking about academics, you go to HR, you go to your chairman, you go to the clinical medical director if you're in practice. Like, walk me through this, like what it actually looks like.
So just from my experience, what I did when I disclosed, I disclosed to my chairman, right, or chairwoman, and it was a risk, it was a gamble, right, to just put myself out there. But Chris Kane, he back in 2009, we had this conversation, and he said, all right, you got basically no chances, right? Like if you F this thing up. And I needed those guidelines though, right? There are lots of EAPs that are opening up, and they say they're anonymous and all that, and I think that's great. But I don't know if they're standardized in terms of what they disclose, or there's a lot we don't know behind closed doors, right? With leadership, unfortunately. And so,
can I ask you a quick question? Did you disclose before or after you matched?
I disclosed after I matched, right? And I had a mentor back in Detroit that I was like, what should I do, right? He's like, just match first. Just match first. And that was the right thing. I think there's a difference. Okay, this one's a little tricky, between honesty and the truth. Being honest is you're honest with yourself. You want to get better. You're doing the right things, but sometimes the whole truth can jeopardize your whole career, right? And someone in recovery had told me this, and not everyone ascribes to that. But I think physicians, we have to realize that if you have, addiction issues, that we're no different than anybody else, but we are different in our profession, what is put out there and how we're regulated. And, being an advocate for yourself is sometimes very difficult.
Yeah, I can only imagine. And when you say you've got to disclose to the right person and that it's a gamble, like, you don't know.
You don't know.
I mean, the other half of that could have been like, we don't really have the room to kind of help you navigate this. Go demonstrate for a year or two to be sober, then come back and reapply. And, now you're doing research in other different spots where maybe you say, this is not ultimately going to transpire. And then, of course, the other is, this kind of gets disclosed for you. You do something, it's public. I mean, you come to school, work under the influence, you get a DUI, and that somehow becomes public domain. You're applying for a job, and have you ever been arrested or blah, blah, blah. What does that kind of look like?
Tricky. So I know physicians that, everything went very public in a bad way. They're no longer practicing, basically. They're doing other things. Totally fine, because it's there's a point where it's hard to come back, and is it worth it? And
you're saying from the individual's perspective.
Yes, right. Like it's difficult once this trail kind of follows you everywhere. Some folks have had to move or take a different type of job. When I was let go from academics, I kind of had to let go of the idea that I'd probably be hired by an academic center again. And I was okay with that, right? Like looking back in hindsight, it wasn't necessarily the right fit for me. I like doing it. I like teaching, but I found, oftentimes in life, like the things for me that I've, been the most satisfied with are the things I know, like I didn't know I needed it, right? Like I didn't know I really needed a private practice gig. That's very fulfilling to me. that allows me to continue practicing in a more stable way. As you know, there's academic pressures, and I'm, a little bit envious of, all these folks that can actually deal with all this, because I don't know, right? Like, my experience is I got stressed out very easily, and, I had kind of outsized reactions and all that. And then I see people do it, and I know it's not effortless, but there's a lot of folks out there that are maintaining, and they're doing it correctly. And there's a lot we can learn from those folks as well, in terms of, work-life balance, and see how they keep it going.
Has it kind of worked into patient interactions at all? I mean, is this something that comes up, or is it public? Is it selective? If and when there's a patient that you think, sharing some of your personal story might be appropriate?
I do, and I can tell you, every time I've not regretted it, right? Because I can tell it takes one to know one, right? If I suspect, someone has a mental health issue, or, sometimes drunk at the office, I'll just probe a little deeper, right? And then kind of direct them, deal with their urologic issue in whatever way, and can direct them to the appropriate help. And some people have, gotten sober or gotten their mental health addressed. And so, yeah, I do. And, when I had my episode in 2021, I kind of disappeared. Like, I had some sort of, online presence, and then I kind of came back and, said, this is where I've been, this is what I've gone through. And this is kind of where the idea for Safe Haven came out, because I got some phone calls from people, trained with or went to med school. I'm like, oh, I haven't heard from you in a while. And it would be, my life is falling apart. And like, what did you do to get through it? I was like, oh, okay. And that happened, a good 3 or 4 times. And it just provided that, a peer-to-peer support network was born organically out of that, which was cool. And another source of wanting to start Safe Haven was, I have a friend who has ADHD, and they were introducing me to this app to help with ADHD. And it's all run by people that have had these issues, how they cope, just a lot of life planning and organization skills, which they lack. And then I saw it work, right? I think it's no different for physicians, where we just need some guidance from somebody who's been there, walked the path, and made it through. Like, I'm still alive, definitely shouldn't be, and I'm still practicing as a physician, definitely shouldn't be, but I did it. And there's a way through, because when you're in the darkest time, it just feels so permanent. Like, it's like this forever. Nothing will ever change. And I can remember that, it's like, it's not worth it. There's nothing to live for. And it's just not true. It's just not true. There's a way out.
Yeah. And I mean, I think you're sharing one end of the spectrum where, things were pretty serious and ultra impactful. Clearly there's gradients, and just because you're not at that extreme, if you will, doesn't mean that things couldn't be substantially better, and that there's perhaps lower levels of substance abuse, mental health that are super impactful, right? All we know is what we know. And I think what you're describing, most people would agree, is pretty lonesome and intense, but there's all types of intermediate levels of the full spectrum that maybe we could all benefit from. And I guess, like so many things that are challenging, tough, requiring a degree of vulnerability, even just normalizing the conversation a little bit, that, hey, this is what's going on. Here's some statistics that you're 1,000% not alone.
Yes.
Right? This is, if anything, like almost like the rule, not the exception.
Exactly.
And I mean, maybe with that, I'd love to hear, what is your message to the listenership? What are the goals with Safe Haven, as you continue to use your experiences to positively impact other people?
Right. I don't think the majority of the, listeners or physicians are as bad as me, because that would be a big problem if everyone was like this. And I think some people are somewhere in the middle, or don't have these problems. And it may never amount to like what I went through. But there are select few, right, that are out there that are like, okay, this really resonates with me. This is like what I'm going through, and it's really for them, right? You know, my message for Safe Haven, the mission of the platform of our service is to make people feel like they're not alone, because these mental health issues, substance use, the way they work internally is to isolate, you know, and it feeds on that. It feeds on the isolation, and it just worsens there. You know, it's like it suffers in that spiral. And sometimes there's no thinking your way out of it. You just need that hand from outside to say, hey, you know, I needed that. You know, my friend, who's my friend now, who I was introduced to, that's the service. The service is say, you're not alone. What you're feeling is all valid, 100%. Right? It's not wrong to have these issues or these feelings. And while this may feel permanent, there's a way out. I don't know what it even looks like for you, but there's a way out.
Well, Nishant, I can't thank you enough for coming on and, you know, sharing some parts of your life. Again, the highs and lows, certainly for myself. I think for everybody, there's going to be something to introspect and reflect on. So thanks for sharing your story. Thanks for kind of trying to pay it forward to other people that are out there. And easy enough, SafeHavenMD.com.
Yes, sir.
All right, man.
Thank you so much.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend.
If you have any questions or comments, DM us at _BackTable on Instagram, LinkedIn, or Twitter.
BackTable is hosted by Aditya Bagrodia
and Jose Silva.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening, and see you next week.